So good evening to all of you. Welcome back to the MCQ and image based revision specifically for you, for the NEET students, for the NEET PG. Okay, so I'm Dr. Pradeep Pawar, Professor of Anatomy, and I've got a vast experience of teaching the UGs as well as the postgraduate entrance students, India and abroad. Okay, so we'll start with the first MCQ, students. Here we go. Answer this. So which of the following structure passes through greater sciatic foramen? Yes, the question is open to you. You can answer. Which of the following structure passes through the greater sciatic foramen? Come on, students, come on. Attempt to answer, even if it is wrong, it's okay. You're just gaining knowledge. Answer this. I'm looking at the screen, I'm waiting for you. Greater sciatic foramen, lesser sciatic foramen. Yes. So answer for this is going to be the superior gluteal nerve and vessels. The superior gluteal nerve and vessels. Correct? Now just have a look at this slide and try to understand this. Tell me, students, what is this ligament here? A ligament which begins from the sacrum to the ischial tuberosity. This one. A ligament which begins from the sacrum to the ischial tuberosity. This is what we call as the sacrotuberous ligament. Correct? That's a sacrotuberous ligament. And the ligament which begins from the sacrum to the ischial spine. Yes, and that's the sacrospinous ligament. So we've got two ligaments, the sacrotuberous and the sacrospinous, and incidentally these two ligaments are representing the degenerated parts of the muscle. Okay, ये जो sacrotuberous ligament है, it represents the degenerated part of which muscle is that? Can anyone answer this? The sacrotuberous ligament is going to represent the degenerated part of, yes, the long head of biceps femoris, the long head of biceps femoris. And the sacrospinous ligament is going to represent which muscle? The coccygeus muscle. Just remember this, very important. So sacrotuberous is a degenerated part of the long head of biceps femoris, and the sacrospinous ligament is a degenerated part of the coccygeus muscle. Now, these two ligaments will convert this. What is this notch, bacho? This is the greater sciatic notch. And what is this notch? The lesser sciatic notch. So the greater sciatic and the lesser sciatic notches are converted now into foramens. This is what we call as the greater sciatic foramen, and this is the lesser sciatic foramen. Okay, so the greater and the lesser sciatic notch are converted into greater and lesser sciatic foramen by the sacrotuberous and the sacrospinous ligaments. Perfect to all of you. Okay, so now you tell me what are the structures which are getting out through this greater sciatic foramen. Can anyone answer this? There's a big pear-shaped muscle which gets out from here. Yes, that's a pear-shaped muscle, and this pear-shaped muscle comes and gets inserted on the tip of the greater trochanter. What is this muscle which comes and gets inserted on the tip of the greater trochanter? That's the piriformis muscle, piriformis. And from this lesser sciatic foramen comes out a muscle. What is this muscle? Can anyone answer this? A muscle which gets out through the lesser sciatic foramen. That's the obturator internus. Obturator internus. So that's the tendon of obturator internus. So this is the greater sciatic foramen. What gets out through this is the piriformis. Anyone? Anything else which gets out through the greater sciatic foramen? I'll just put a white screen for you. Chalo, we'll start with this. One is the piriformis muscle. Piriformis. Anything else? There's a nerve and vessel which goes above the piriformis. What is that? The superior gluteal nerve. The superior gluteal nerve and vessels. Superior gluteal nerves and vessels. This is the only nerve and vessel that goes at the upper border of piriformis. ठीक है? ये एक ही nerve and vessel होता है which is present at the upper border of the piriformis. Everything else goes below the piriformis. What is this now? The inferior gluteal nerve and vessels. The next is the sciatic nerve. Sciatic nerve. On the medial aspect of the sciatic nerve, there's a nerve. What is the name of that? The posterior cutaneous nerve of thigh, posterior cutaneous nerve thigh. Then there is nerve to obturator internus. There's nerve to obturator internus, and what does it supply? It supplies two muscles. It supplies the obturator internus. It supplies the obturator internus and the superior gemellus. Obturator internus and superior gemellus. The next is nerve to quadratus femoris. Quadratus femoris. And what does this nerve to quadratus femoris supply? It supplies the quadratus femoris as well as the inferior gemellus. Inferior gemellus. Okay. And there are three more structures. One is the pudendal nerve. Pudendal nerve. The second one is the internal pudendal vessels. Pudendal nerve, internal pudendal vessels, and the last one is the nerve to obturator internus. पहले लिख दिया. So ठीक है, these are the structures. One is the piriformis. At the upper border of the piriformis comes the superior gluteal nerves and vessels. At the lower border of piriformis, everything else comes. The inferior gluteal nerves and vessels, the sciatic nerve, the posterior femoral cutaneous nerve thigh, the nerve to obturator internus. This is a very important MCQ, students, which supplies the obturator internus and the superior gemellus, the nerve to quadratus femoris, which supplies the quadratus femoris and the inferior gemellus, and the pudendal nerve and internal pudendal vessels. Pudendal nerve and internal pudendal vessels. Just remember all this. Okay, and now understand this, students. ये जो pudendal nerve है and internal, the pudendal nerve, I'm so sorry, one moment. The pudendal nerve and the internal pudendal vessels, they come out through the greater sciatic foramen. Okay, there are three structures which get out through the greater sciatic foramen. These three structures will wind around the ischial spine. Can anyone answer this? What are these three structures which are going to turn around the ischial spine in sequence? This is P, this is I, and this is N. P is the pudendal nerve, I is the internal pudendal artery, and N is the nerve to obturator internus. So these are the three structures which get out from the pelvis. They turn around the ischial spine. Look at this, students. They wind around the ischial spine and now they enter into the lesser sciatic foramen. And जैसे ये lesser sciatic foramen के अंदर जाते हैं, the moment they enter into the lesser sciatic foramen, students, they now come into, what is this region? What is this region? Below this line. Below this line. This line gives origin to a muscle which is known as the levator ani. Levator ani. And above the levator ani, this is what we call as the pelvis proper. Pelvis proper. And below the levator ani, this is what we call as the perineum. Perineum. So there are three structures which go out of the pelvis through this greater sciatic foramen. They turn around the ischial spine and they enter into the lesser sciatic foramen. These are the these are the pin structures: pudendal nerve, internal pudendal vessels, and the nerve to obturator internus. I hope this is clear to all of you. Okay, now see the other options in the MCQ. Just see the other options. The tendon of obturator internus. Tell me, students, what is the muscle which arises from here? From the obturator foramen inside, from the inner aspect of the obturator foramen arises the obturator internus, and the tendon of obturator internus gets out through lesser sciatic foramen. It gets out through the lesser sciatic. So remember, students, three structures come in the lesser sciatic foramen and there's one structure which gets out of the lesser sciatic foramen. Who comes in? PIN. That's PIN. Pudendal nerve, internal pudendal vessels, and the nerve to obturator internus. And who gets out is the tendon of obturator internus. The tendon of obturator internus gets out through the lesser sciatic foramen. Anterior cutaneous nerve thigh. Can anyone answer this? What is this anterior cutaneous nerve thigh? Yes, bachcho, can anyone tell me? You can answer, you can guess, you can always, answer. If you make a mistake, you'll remember it, bachcho. Anterior cutaneous nerve of the thigh supplies the skin on the anterior aspect of the thigh. Correct? It supplies the skin on the anterior aspect of the thigh, and this is a branch of what? Anyone? Anterior cutaneous nerve of the thigh is a branch of femoral nerve. It's a branch of femoral nerve. And जो posterior cutaneous nerve thigh था, posterior cutaneous nerve thigh, that's a branch of sacral plexus. That's a branch of sacral plexus. Are you getting this? So I'll just enumerate this for you. One moment. I'll just enumerate this for you. Cutaneous nerves of thigh. We have got cutaneous. Understand this. Nerves of thigh. To be very specific, how many cutaneous nerve thigh are there? How many cutaneous nerves of thigh are there? One is the anterior cutaneous nerve. Second is the medial cutaneous nerve. Third is the lateral cutaneous nerve thigh, and the last one is the posterior cutaneous nerve thigh. Okay, so anterior, आगे होगा medial, lateral, and posterior. There are 4 cutaneous nerves of thigh. Can anyone tell me the anterior and medial cutaneous nerves of thigh are branches of what? These are branches of anterior division of femoral nerve. These are branches of anterior division of femoral nerve. The lateral cutaneous nerve thigh is a direct branch of lumbar plexus. Lumbar plexus. And students, do we know anything else? Can you add to this something else about the anterior, about the lateral cutaneous nerve thigh? This lateral cutaneous nerve thigh gets compressed against the inguinal ligament. This is the nerve which gets compressed against the inguinal ligament. The person complains of paresthesia, tingling and numbness along the lateral aspect of the thigh, and this is what we call as the meralgia paresthetica. Okay, this is meralgia paresthetica, compression of lateral femoral cutaneous nerve thigh against the inguinal ligament. And the posterior cutaneous nerve thigh is a branch of sacral plexus. ये है branch of sacral plexus. I hope this is clear to all of you. Right. Now coming to the last option here, semimembranosus tendon. Semimembranosus tendon is a hamstring. This semimembranosus belongs to the posterior compartment of the thigh, begins from the ischial tuberosity, and this semimembranosus is attached to the medial condyle of tibia. Right? Correct, it is attached to the medial condyle of tibia, begins from the ischial tuberosity. That's the semimembranosus muscle. Semimembranosus. Okay, I hope this is clear to all of you. Come on, we'll go to the next MCQ then. Identify this pointed structure. Students, come on, identify. If you can answer this, pointed structure. Anyone? Yes, come on students, answer. What is this pointed structure? This is a muscle. And which is this artery behind the muscle? What is this artery going behind the muscle? You can see this artery. This is the subclavian artery. That's the subclavian artery. And this subclavian artery would be divided into 3 parts by this muscle. This is the scalenus anterior muscle. Scalenus anterior. This is a view of the thorax. You're looking at the anterior wall of the thorax from inside. Andar se dekh rahe ho. You're looking at the anterior wall of thorax from inside the thorax. Correct. That's a subclavian artery, and this subclavian artery is divided into 3 parts by this muscle, which is known as the scalenus anterior. Scalenus anterior muscle. That's the first part. Behind the muscle, that's the second part, and that's the third part. Okay, first part is from its beginning to the muscle, second part is behind the muscle, and third part is after the muscle. So the subclavian artery is divided into 3 parts by scalenus anterior. And who lies in front of the muscle? What is this structure? What is this structure? In front of the muscle would lie the subclavian vein. Subclavian vein. So what separates the subclavian artery from the subclavian vein? The scalenus anterior. Scalenus anterior. Can anyone identify this muscle? Your students, what is this muscle? Come on. Guess this. What is this muscle? A muscle which begins from the sternum and goes to the costal cartilages. Can anyone tell me what is this muscle? Begins from the sternum and goes to the costal cartilages. Yes. Come on, students, answer. Bolo. No one is answering anything. A muscle which begins from the sternum and a muscle which goes to the costal cartilages. You can guess this. This is what we call as the sternocostalis. इसे हम बोलते हैं sternocostalis. And this sternocostalis is a part of which muscle? Sternocostalis is belonging to which muscle? Yeah, एक मिनट. You just tell me which are the three intercostal muscles. ये तीन intercostal muscles क्या होते हैं? Can anyone answer this? Three intercostal muscles. One we already know. One is the external intercostal. One is the external intercostal. The second one is the internal intercostal. Barabar. One is external intercostal. The second one is internal intercostal. And the third muscle, for all practical purposes, we take the third muscle as innermost intercostal. Students, we take the third muscle as innermost intercostal. But this innermost intercostal is actually belonging to a muscle which is known as the Transverse Thoracicus. एक मसल होता है जिसका नाम है Transverse Thoracicus. Transverse Thoracicus. Now, this Transverse Thoracicus is made up of three parts. Understand this? मतलब normally when we talk about external and internal. The third one is actually the Transverse Thoracicus, which is broken down into three parts. इसके तीन parts होते हैं Transverse Thoracicus के. The one in front is known as the sternocostalis. The second one is known as the innermost intercostal. This we know. And the third one is known as the subcostalis. So sternocostalis, innermost intercostal, and the subcostalis. These are the three parts of the Transverse Thoracicus. Are you able to follow this? So look, normally when we talk about intercostal muscles, we talk about external, internal and innermost intercostal. But students, now clear, this innermost intercostal actually belongs to a big muscle जिसका नाम है Transverse Thoracicus, whose other two parts are sternocostalis and the subcostalis. But when we talk about external, internal and innermost intercostal. ठीक है ना? तो ये जो मसल है ना, and where do the nerves and the vessels lie? What is the neurovascular plane of the thorax? It lies between the internal and the innermost intercostal. Okay, the neurovascular plane of the thorax lies between the internal and the innermost intercostal. Where? In the costal groove. Along the inferior border of the rib, and sequence क्या होगा? Vein, artery, nerve, from above downwards. Vein, artery, nerve. And this sequence is reversed in first rib. Okay, so this muscle is the sternocostalis. I hope this is clear to all of you. Sternocostalis. Can anyone tell me what is this artery here? ये क्या artery है which runs on either sides of the sternum? The artery which runs on either sides of the sternum. The artery is a branch of the first part of subclavian artery. देखो बच्चों, this is the first part of the subclavian, and the first part of the subclavian gives a branch here. What is the name of this artery? Can anyone answer this? This artery runs on either sides of the sternum inside the thorax. We call this as the internal thoracic artery. It divides into two branches. This is what we call as the superior epigastric, and this is the musculophrenic artery. So the internal thoracic artery divides into a superior epigastric and musculophrenic artery. Clear to all of you? This is clear. This you know. Okay. Anything else here? That's it. Okay, fine. Going to the next MCQ. Have a look at this. Answer this. Which of the following is not a branch of first part of maxillary artery? Can anyone answer this? This is a very, very important MCQ. Maxillary artery you should know. बोलो बच्चों, बोलो, कुछ तो बोलो. Which of the following is not a branch of first part of maxillary artery? Yes. The answer is greater palatine. Okay, answer is greater palatine. Now quickly you answer my questions. This maxillary artery is a branch of, what is this artery here? ये कौन सी आर्टरी है? दिस इज द एक्सटर्नल कैरोटिड आर्टरी एंड दिस एक्सटर्नल कैरोटिड डिवाइड्स इनटू टू टर्मिनल ब्रांचेस. दिस इज द सुपरफिशियल टेम्पोरल आर्टरी एंड ये होगा मैक्सिलरी आर्टरी. This maxillary artery is divided into three parts by what is this muscle? ये कौन है? What is this muscle? This is the lateral pterygoid muscle. The lateral pterygoid. So the lateral pterygoid is going to divide the maxillary artery into three parts. ठीक है? From its beginning to the muscle, what is this part? From its beginning to the muscle, that's the first part of the maxillary artery. On the muscle, lying on the muscle, that's the second part. And lateral pterygoids के दो parts होते हैं, दो heads होते हैं, and the third part goes between the two heads of the lateral pterygoid muscle. Clear? So first part is from its beginning to the muscle. That's the first part of maxillary artery. The second part lies on the lateral pterygoid, and the third part goes between the two heads of lateral pterygoid muscle. So what are the branches of maxillary artery? Let us just quickly go through this. Some branches of maxillary artery. Just you have to know, students. So if you know, you tell me. First part. आपको पता है तो आप बोलो. The first part gives 5 branches. One is the deep auricular. Deep auricular. Anterior tympanic. Deep auricular. Anterior tympanic. Middle meningeal. Middle meningeal artery enters the skull through which foramen? Can anyone answer this? The middle meningeal artery enters the skull through foramen spinosum. Accessory meningeal enters through the foramen ovale. And the last artery is inferior alveolar. Inferior alveolar. It enters into which foramen here? The mandibular foramen. Just remember all these things. Huh? Clear? So deep auricular, anterior tympanic. ये दोनों arteries and they go to the ear. Clear? So deep auricular, anterior tympanic. They go to the ear. Middle meningeal passes through the foramen spinosum. Accessory meningeal passes through the foramen ovale, and inferior alveolar artery enters the mandibular foramen along with inferior alveolar nerve. Along with inferior alveolar nerve. The second part of maxillary artery corresponds to the anterior division of mandibular nerve. बस ये याद रखना. So branches of second part of maxillary artery, they correspond to the anterior division of mandibular nerve. So what are the arteries? Masseteric artery, deep temporal artery, masseteric artery, deep temporal artery. They supply the muscles, the muscles of mastication. So masseteric artery will supply the masseter. Deep temporal artery is going to supply the temporalis. Artery to the pterygoids. Artery to the pterygoids. And the last one is buccal artery. Buccal artery. Okay. So these are the 4 branches from the second part. Students, this is the easiest way to remember this. Huh? ऐसे याद रखना, the second part of maxillary artery है ना, it corresponds to the anterior division of mandibular nerve. So mandibular nerve anterior division के जो branches होते हैं, same are the branches of second part of maxillary artery. Difficult is third part. Third part gives 1 posterior superior alveolar. Posterior superior alveolar, infra orbital, greater palatine. Greater palatine. एक mnemonic बना सकते हो उसका third part का आप. Just take the first letters and make a mnemonic. So that's how you remember. Posterior superior alveolar, मतलब it supplies the posterior and the upper teeth. Infraorbital artery comes out through this foramen here, infraorbital foramen. The greater palatine artery of pterygoid canal. Artery of the pterygoid canal, pharyngeal artery. Pharyngeal artery. And the last one is spinopalatine artery. Spinopalatine. Now students, एक MCQ आया था long back. Pharyngeal artery is a branch of what? And students have answered this pharyngeal artery as a branch of external carotid artery. Wrong hai, wrong hai. The branch of external carotid with the name pharyngeal, what's that? The branch of external carotid with the name pharyngeal is ascending pharyngeal artery. That's the ascending pharyngeal artery. Okay, pharyngeal artery is a branch of the third part of maxillary artery. Pharyngeal artery is a branch of third part of maxillary artery. Very good, very good. Melissa, very good. Like this you answer. Jitna answer karoge na, it will be very easy for you to understand and for me to teach too. So artery of the branch of the external carotid is ascending pharyngeal artery. Ascending pharyngeal. Perfect, perfect, perfect. Okay, so this is all about the maxillary artery. Look at this slide once again. So that's a maxillary artery. Can anyone tell me what is this? What is this nerve? ये मैंने बोला था last time. If you remember this, can anyone answer this? What is this nerve? What is this nerve? Students, come on. You can crack this MCQ. What is the name of this nerve? Anyone? You can guess, bacho, you can guess. There are two nerves I told you. What is this area that you're looking at? That's the infratemporal fossa. ये मैंने बोला था आपको. The moment you remove the ramus, this is a very important visual slide. Students, this is a very important visual slide. The moment you remove the ramus of the mandible and you go deep to the ramus, you are right inside the infratemporal fossa. तो ये जो आप देख रहे हो, this area that you're looking at is the infratemporal fossa. In this infratemporal fossa, there are two muscles of mastication. One I've told you is the lateral pterygoid, and the other one is the medial pterygoid. है ना? ये lateral and medial pterygoid होते हैं. The second content of the infratemporal fossa is the maxillary artery. The third is the mandibular nerve with its divisions, with its branches. So which is this branch of mandibular nerve? The one in front. जो आगे है ना, that's नहीं. That is not inferior alveolar. Inferior alveolar ये है. This is inferior alveolar. And how do you identify this inferior alveolar nerve? Because it is going into the mandibular foramen. That's how we identify the inferior alveolar nerve, students. Because it is entering inside the mandibular foramen along with the inferior alveolar artery. So that's the inferior alveolar nerve. Can anyone tell me what is this nerve? Chalo students, answer this. I've told you this in some or the other slide. Can anyone tell me what is this nerve? The nerve in front. Sorry. The nerve in front. This one. The nerve in front of the inferior alveolar nerve कौन सा है? The nerve related to the third molar tooth. Answer now. I've told you this answer. The nerve related to the third molar tooth. Can anyone answer? Yes, very good. Somin. Yes, very good. That's the lingual nerve. Correct. That's the lingual nerve. So the nerve related to the third molar tooth is the lingual nerve. Just remember that. And this is the nerve which gets damaged during molar extractions. Okay, this is the nerve. The lingual nerve gets damaged during molar extractions. Perfect, perfect. And can anyone tell me what is this? What is this line drawn? ये line देख रहे हो? This white line. Can anyone guess what is this white line here? Come on, students. I'll give you 2 minutes to think. What is this white line? Come on, Somin. Come on, Melissa. Tanmay. Yashwant, very good. Very good. I want you to answer like this. What is this white colored structure that you're looking at? Can you see that? Dikh raha na ye? Haan, very clear dikh raha ye. It's seen very clearly, that white colored structure. Can anyone tell me? And you know, this is very important. Pterygomandibular raphe. Very good, Melissa. That's the pterygomandibular raphe. And you know, the dentist specifically, when they are anesthetizing around when they are giving an anesthesia around the inferior alveolar nerve, they go inside the mouth, they feel for this pterygomandibular raphe, and then they will give anesthesia around the vicinity of the inferior alveolar nerve there. Okay, behind it would lie the inferior alveolar, thoda sa piche ki taraf, right? So that's the pterygomandibular raphe. And can anyone tell me why is this pterygomandibular raphe so important? This pterygomandibular raphe gives origin to two muscles. एक muscle पीछे जाएगा and one muscle will go in front. One is behind and one is in front. Tell me, who's that? which is the muscle which arises from the pterygomandibular raphe. This we are looking from inside. अगर बाहर से देखते हो, it's very clearly seen. Can anyone tell me which is the muscle which goes in front of the pterygomandibular raphe, which arises from the pterygomandibular raphe? हाँ, in front, आगे, superior constrictor पीछे जाएगा, Melissa. It goes behind, and the muscle in front is the buccinator. Be very, very clear. So what I want you to understand, children, pterygomandibular raphe gives origin to two muscles. The muscle in front, buccinator. The muscle behind is going to be the superior constrictor muscle of the pharynx. Perfect. Perfect. Superior constrictor muscle of the pharynx. Correct. Can anyone tell me what is this nerve? What is this nerve? Guess, students, guess. What is this nerve? This nerve goes up, and this is the nerve which accompanies an artery here, the same artery going up. The same artery going up, that's the superficial temporal artery. The superficial temporal artery goes with a nerve. Can anyone guess this nerve? Can anyone guess this nerve? That's the auriculotemporal nerve. This is the auriculotemporal nerve, okay? Just remember this. This is the auriculotemporal nerve, and the artery is the superficial temporal artery. Superficial temporal artery. Perfect. Just one last thing in the slide. Tell me, what is this artery? What is this artery? Yes, very good. What is this artery which comes out through the infraorbital foramen? From the infraorbital foramen comes a nerve and an artery. Artery मैंने अभी आपको बोला. That's the infraorbital artery. And the nerve which comes out through the infraorbital foramen is the infraorbital nerve. Infraorbital nerve. Infraorbital nerve and infraorbital artery. Perfect, perfect. Okay. Right, that's it. Can anyone tell me what is this? ये क्या हो सकता है? Look at this artery. This artery. There's a muscle attached here to the angle of the mandible outside. Outside यहाँ पे एक muscle है. That's a masseter. The muscle here is masseter. And what is this artery here which goes on the anterior border of masseter? Can anyone answer this? On the anterior border of masseter, that's the facial artery. That's the facial artery. Okay, that's about the slide. That's the facial artery. Okay, going to the next MCQ. Identify this pointed structure. Yes, students. Sorry. Identify this pointed structure. Sorry. Come on, students. You can crack this MCQ. Identify this pointed structure. What is that? Hello, Parth. So, Parth, what is this pointed structure? Come on, identify. Mammillary bodies. Yes, very good, Zubair. That's the mammillary bodies. And what is this in front of the mammillary bodies? Can anyone answer this? In front of the mammillary bodies, what is that? That's the pituitary stalk. Pituitary stalk. You can see very well, no? That's the infundibulum or the pituitary stalk or the tuberous cinereum. Tuberous cinereum. Yes, Parth. Okay. What is this structure? Can anyone tell me what is this structure? And beautiful fibers you can see passing through the structure. What is that? Yes? Oh, great. Very good, very good. Very good, Parth. Very good. That's a crus cerebri. Yes, very good. That's a crus cerebri. And what are the fibers passing through the crus cerebri? Can anyone answer this? What are the fibers passing through the crus cerebri? These are the corticospinal fibers as well as the corticonuclear fibers. Corticospinal and corticonuclear fibers pass through the crus cerebri. Now you tell me, students, what is this? What is this nerve here? What is this nerve? Can anyone guess this? What is this now? I'll just magnify this. ये थोड़ा सा magnify किया. चलो मैंने I magnified this. What is this now, students? What is this now? Which arises from the midbrain. Which arises from the midbrain on the ventral aspect. Anyone? What is this nerve? Chalo, bolo, bachcho, come on. This is the third nerve. Yes, very good, Zubair. Very good. That's the oculomotor nerve. Oculomotor. And what is this nerve? Students, can you see? This is the only nerve which is emerging from the dorsal aspect of the midbrain, of the brainstem. The only cranial nerve which emerges from the dorsal aspect of the brainstem. This is going to be the trochlear nerve. Trochlear. So that's a trochlear nerve, that's a oculomotor nerve. And students, what am I showing you? This rhomboid shaped structure. What is this area known as? This is what we call as the interpedicular fossa. ये जो rhomboid shaped structure देख रहे हो, this is what we call as the interpedicular fossa. And what are the structures? I mean, what are the boundaries of interpedicular fossa? The boundaries of interpedicular fossa on either sides, anterolateral is going to be the optic tract, anterolateral is the optic tract, and posterolateral is going to be the crus cerebri. Crus cerebri. Posterolateral is the crus cerebri and anterolateral is the optic tract. And this area is the interpedicular fossa. The contents of the interpedicular fossa, children, the contents will be the third nerve, and there's a circle of Willis here. Circle of Willis hoga, it's not shown here. So third nerve and the circle of Willis lies in the interpedicular fossa. I hope this is clear to all of you. Now tell me, students, there will be an artery which lies here. You pons dekh rahe ho aap? This is the pons. Is this not pons? Yes, this is pons. And what is the artery which lies in the midline of the pons? Anyone? The artery which lies in the sulcus, we call this as the basilar sulcus. What is the name of the artery? The basilar artery. The artery is basilar artery. And what is this which is entering into the cerebellum? Can anyone answer this, children? What is this structure which is entering into the cerebellum from the pons? From the pons it is going into the cerebellum. And this is what we call as the middle cerebellar peduncle. This is what we call as the middle cerebellar peduncle. And what is the nerve which is attached at the junction of the pons with the middle cerebellar peduncle? Ye kya nerve hoga? Can anyone guess this? Students, the nerve attached between the pons at the junction of the pons and the middle cerebellar peduncle. What's that? Chalo, the question is open to all of you. You can guess. Trigeminal. Very good, Melissa. That's a trigeminal nerve. So the nerve attached at the junction of the pons with the middle cerebellar peduncle is trigeminal. Excellent. What is this junction? That's a pons, that's a medulla. Students, what is this junction known as the pontomedullary junction? Yes, pontomedullary junction. And what are these nerves attached here? This is 1, this is 2, and this is the third nerve. Anyone? What is this nerve? This is the, which are these 3 nerves attached to the pontomedullary junction? Can anyone answer this? That's the 6th, that's the 7th, and that's the 8th nerve. 6th, 7th, and 8th nerve. 6th, 7th, 8th. What are these elevations in the medulla known as? These elevations in the medulla. Can anyone answer this? What are these elevations in the medulla known as? These are the pyramids. These are the pyramids. What are these elevations in the medulla known as? The olives. So this are the pyramids, this are the olives, and lateral to the olives or lateral jaoge. So that is going to be the inferior cerebellar peduncle. Inferior cerebellar peduncle. Very good. So these are the pyramids, these are the olives. Thoda sa or lateral jaoge, so you will be getting the inferior cerebellar peduncle. Can anyone tell me how are these pyramids formed? How are these elevations formed? Pyramids, how are they formed? Can anyone answer this? Yes, Sabasi, tell me how these elevations, the pyramids formed. These are formed by the crossing of corticospinal tracts. The corticospinal tracts cross, they form elevations here. Name the pyramids. That is known as pyramids. How are this olives formed? Olives. अगर आप इसके अंदर जाते हो, you go deep to the olives, you get a nucleus. Students, you get a nucleus. Name of the nucleus. Can anyone tell me what is the name of this nucleus which begins from the olives? I mean, which is located deep to the olives. Name of the nucleus located deep to the olives. Come on, students, come on. You can answer this. Chalo, bolo, bachcho. What is the name of the nucleus deep to the? Look at this. Ye dekho. What is this first elevation? Pyramids. है ना? ये pyramids है. Next to the pyramids, what is this elevation? Olives. Next to the olives, what is this elevation? That's the inferior cerebellar peduncle. That's the pyramids, that's the olives, and that's the inferior cerebellar peduncle. Can anyone tell me what is the nerve present between the pyramids and the olives? Between the pyramids and the olives is the 12th nerve. And between the olives and the inferior cerebellar peduncle, you get 3 nerves. That's the 9th, 10th, and cranial accessory. The 9th, 10th, and the cranial accessory are present between the olives and the inferior cerebellar peduncle. Gracialis पीछे है, so I mean, the gracialis nucleus, gracialis, the nucleus cuneatus are posterior, पीछे होते हैं, पीछे. So this is a ventral view of medulla. This is a ventral view of medulla. And if I show you the dorsal view of medulla, dorsal view, just have a look, students. अगर पीछे से देखते हो आप, the dorsal view, what is this? This is one elevation, that's a second elevation, and that's a third elevation. अब ये पीछे से देख रहे हो. So what is this first elevation? This is the fasciculus gracialis. Fasciculus gracialis. The second elevation is going to be the fasciculus cuneatus. And the third elevation is the inferior cerebellar peduncle. So I hope this is clear to all of you. So if you see the medulla, आगे से पीछे जा रहे हो, you're going from anterior to posterior. The first elevation, pyramids. The next elevation, olives. The third one is the inferior cerebellar peduncle. Come back, you come to the fasciculus cuneatus, and in the midline is the fasciculus gracialis. The cavity in the center is known as the central canal. Central canal. Okay, so the nerves between the pyramids and the olives is the 12th. Between the olives and the inferior cerebellar peduncle is the 9th, 10th, and cranial accessory. Okay, perfect. Chalo, great. Is there anything left here? No, nothing is left. We'll go to the next slide. Can anyone answer this? Coming to the next MCQ. While considering the femoral sheath and femoral canal, which of the statement below is incorrect? Any guesses? Any guesses? While considering the femoral sheath and femoral canal, which of the following statement is incorrect? Okay, that's great, Rishi. Very good. You promptly answered this. The sheath contains the femoral nerve. Very good. The femoral sheath में femoral nerve नहीं होती है. The femoral nerve is outside the femoral sheath. The femoral nerve is outside the femoral sheath. So what are the contents of femoral sheath? बोल सकते हो. Contents of femoral sheath is going to be, I'll just make it here only. What are the contents of femoral sheath? There are 3 structures. There are 3 compartments here. In the lateral compartment lies the femoral artery plus the genitofemoral nerve. The femoral branch of genitofemoral nerve. Very good. So the answer is B for this. In the femoral sheath lies in the lateral compartment the femoral artery and the femoral branch of genitofemoral nerve. In the intermediate compartment lies the femoral vein. And the medial compartment is empty. Empty hota hai ye. What is this known as? This is known as the femoral canal. Femoral canal. The upper part of the femoral canal is known as the femoral ring. The upper part is known as the femoral ring. Can anyone tell me how is this femoral sheath formed? Anterior wall of femoral sheath is formed by what? Posterior wall of femoral sheath is formed by what? Come on, students. The question is open to you. Anterior wall of femoral sheath formed by. Answer this. Anterior wall of femoral sheath is formed by. Anyone? Anyone? I'm waiting for your answer. The anterior wall of femoral sheath is formed by fascia transversalis. Fascia transversalis. That's the fascia of the abdomen. Anterior abdominal wall, the fascia transversalis comes down. That's the anterior wall of femoral sheath. And the posterior wall of femoral sheath is formed by what? The fascia iliaca. The posterior wall is formed by fascia iliaca. Okay, just have a look. The femoral sheath is continuous with the fascia transversalis. Yes, that's correct. The femoral sheath is a continuation of the fascia transversalis. Yes. The femoral canal lies within the femoral sheath. That's correct. It's the medial most compartment of the femoral sheath, the femoral canal. The canal is wider in females. The femoral ring and the femoral canal is wider in females. Why? Because the pelvis is wider and the femoral vessels are of smaller size. The pelvis is wider in female and the femoral vessels are of smaller size. The femoral hernia is, the femoral canal is wider in females. Tell me, so chances of femoral hernia are more common in whom? The chances of femoral hernia are more common in females. Fine. Okay, because the femoral ring, the femoral canal is wider in females. So fine, tell me students, अगर femoral hernia होता है, you have to widen the femoral ring. You have to cut one of the boundaries of the femoral ring. Which is that boundary which you cut? Chalo bolo students. If there's a femoral hernia, which boundary of the femoral ring do you cut? Answer students. Come on. Ye dekho. I'll just make this. This is the lateral, this is the intermediate, that's the medial compartment. That's the femoral canal here. Okay, so this is the anterior boundary, this is the medial, this is the posterior, and that's the lateral. Tell me, if there's a femoral hernia, which boundary of the femoral ring are you going to cut as a surgeon? Not the anterior boundary, no, not the anterior. Tell me, anterior boundary is formed by what? Anteriorly is formed by inguinal ligament. Anterior boundary of femoral ring is the inguinal ligament. Yes, very good. Posterior is what? Posterior is the pectinate ligament. Medial is the lacunar ligament. Lacunar. And laterally is the septum separating it from separating it from the femoral vein. Your femoral vein. Na? So laterally is the septum separating it from the femoral vein. Is this clear to all of you? So that's the femoral canal. Anterior boundary is formed by, yes, anterior boundary is formed by inguinal ligament. Medially is the lacunar, picture of the ear, pectinate, and laterally is the septum separating it from the femoral vein. So agar femoral hernia hota hai, so which boundary to be cut? The medial boundary. Excellent, very good. Valai, we cut the medial boundary, we dilate the femoral ring, you reduce the hernia and you put a mesh dal dete ho. That's how you reduce the hernia. Fine. You cut the lacunar ligament, but occasionally, rarely, there's someone who lies on the lacunar ligament. Can anyone guess this, students? There's someone lying on the lacunar ligament. And agar aap ye lacunar ligament ko cut karte ho, it would lead to hemorrhage. What is that which lies on the lacunar ligament? Any guesses? There's someone lying on the lacunar ligament. Any guesses, bacho? Artery, barabar hai na, naam bolo na. Walai, tell me the name of the artery. This is very important. What artery is that? Come on, students. This artery is the abnormal obturator artery. Abnormal obturator artery or the accessory obturator artery. Accessory obturator artery. And this abnormal obturator artery is a branch of inferior epigastric artery. Inferior epigastric artery. Take care. So if you cut this abnormal obturator artery, there's going to be a hemorrhage. Perfect. Very clear to all of you. And tell me, students, there's someone who's lying here on the femoral ring. What is this which lies on the femoral ring? That's a lymph node, and this is what we call as the lymph node of Cloquet. Very good, very good. Yes, lymph node of Cloquet or Rosenmuller. Lymph node of Cloquet or Rosenmuller. And what does it drain? What does this lymph node drain? Can anyone answer this? Lymph node of Cloquet or Rosenmuller, and what does this lymph node drains? Any guesses? Very good, very good. Me? Yes. What does this lymph node drain, you tell me? It drains the, any guesses? The lymph node of Cloquet is going to drain the glans penis. Just remember this, इस पर बहुत MCQs आते हैं, glans penis or the glans clitoris. So glans penis and glans clitoris drains into the lymph node of Cloquet. Where the entire penis and the clitoris drains into what? The superficial inguinal lymph nodes. Superficial inguinal lymph nodes. Okay. The penis or the clitoris drains into the superficial inguinal lymph nodes except the glans penis and the glans clitoris, that drains into the deep inguinal lymph node, and that is the lymph node of Cloquet. I hope this is clear to all of you. That's the lymph node of Cloquet. Okay, and where does the testis and ovary drain into? Testis and ovary, bacho, can anyone answer this? The testis and ovary drains into, guess, come on students, guess. The testis and ovary drains into the para-aortic lymph nodes. Para-aortic lymph nodes. Okay, testis and ovary drains into para-aortic lymph node. This you should know. ये बहुत important है. These three things which I told you. Penis and clitoris drains into superficial inguinal lymph nodes. The glans penis and the glans clitoris drains into the deep inguinal lymph node. That's the lymph node of Cloquet. And testis and the ovaries drains into the para-aortic lymph nodes. Para-aortic lymph nodes. Perfect, perfect. Chalo, one last MCQ for you. Before we come to the last MCQ, I'll just brief you, bacho. I'll just brief you about our platform. One moment, I'll just brief you about our platform. So we congratulate all our toppers. Students, these are our students who have got very good ranks in the recent FMG exams which were held, and the results which were announced on 30th of December. All many toppers we have got who have got very good ranks. The interviews will be put on the YouTube after some today or tomorrow. Yes, so we've got a plus subscription in which there are daily live classes, live quizzes, learn from the device of your choice, learn from the top educator, and now you can access to our question bank too. An iconic subscription where you get the best of Unacademy and pre-platter. Some special class features in which there are daily live classes, live quizzes, raise a hand technique, poll for the learners, and suppose if proper notifications will be given, and suppose if you miss the class, you get lecture notes in the form of PDF. You'll be getting lecture notes in the form of PDF. Anytime, anywhere you can attend the class and get your doubts solved. Okay. Now, an updated and highly effective question bank has been prepared with detailed explanatory answers specially for you. Now students, raise a hand technique in which if you press the icon, you can directly talk to the educator. And we are coming up with 2 new batches, the Focus FMG 2022 comprehensive batch starting from 12th of Jan and Target NEET PG 2022 MCQ discussion batch from 12th of Jan. These are the 2 new batches that we are starting. Download the Unacademy app and subscribe to it. And now Unacademy is organizing an event for the SAMHSA, that is South Asian Medical Students Association quiz for the first year students. Okay, there will be webinars, there will be quiz for the first year students. So if you have any friends, you can register on the SAMHSA, SAMHSA website, that's South Asian Medical Students Association. Okay, just one last MCQ. Coming to the last MCQ. Chalo students, answer this. You will get the details on the website. Okay. you'll be having special gifts from Unacademy for the top 3 students. Okay. Chalo, answer student. What is this pointed structure? Yes. What is this pointed structure? Can anyone answer this? Pehle na, which is this aspect of the foot you understand? Ye kaun sa aspect of foot ka? This is the anterior aspect of the foot or the dorsal aspect of the foot. Dorsal aspect, to be very specific, also known as the extensor aspect. Yes, very good, Balai. That's the tibialis anterior. You got this very right, very correct. Congratulations, that's the tibialis anterior. And what is the action of tibialis anterior? If you can answer this. Muscle of the anterior compartment, that's tibialis anterior. Uska main action is going to be dorsiflexion at the ankle joint. The second action is going to be this. What is this for the foot? It turns the foot inwards. What's that? Inversion. A very important MCQ. So what is the action of tibialis anterior? It does dorsiflexion and inversion. Dorsiflexion and inversion of the foot. Okay. So dorsiflexion and inversion. What is this muscle? This is the this is the extensor hallucis longus. Extensor hallucis longus, the muscle which goes to the digits. Here, what's this? Extensor digitorum longus. And the last muscle which goes here, that's the peroneus tertius. So which are the muscles in the anterior compartment of the leg? One, tibialis anterior, extensor hallucis longus, extensor digitorum longus, and the peroneus tertius. Actions of all these muscles is going to be dorsiflexion at the ankle joint. Students, tibialis anterior in addition does this. What's this? Inversion. So tibialis anterior is a very powerful inverter. But students, agar tibialis anterior paralyzed hota hai, suppose if the tibialis anterior is paralyzed, would inversion be lost? What do you say? Would inversion be lost if tibialis anterior is paralyzed? Yes or no? If tibialis anterior is paralyzed, would inversion be lost? That's my question. No. It won't be lost. It would be weak, no, but it won't be lost because we've got very powerful inverters. Which are the very powerful inverters of the foot? Can anyone enumerate this? Very powerful inverters of the foot. These are in the posterior compartment. Posterior compartment ke jo deep muscles hote na bachcho, deep muscles in the posterior compartment. Who's that? That's the tibialis posterior, flexor hallucis longus, and flexor digitorum longus. These are the muscles which does inversion of the foot. These are very powerful muscles. Okay, tibialis posterior, flexor hallucis, and flexor digitorum longus. These are very powerful inverters. So, agar tibialis anterior paralyzed hota hai, inversion is still possible because we've got very powerful inverters in the posterior compartment. Tell me, which is the nerve here? Which is the nerve of the anterior compartment? Any guesses? Which is the nerve in the anterior compartment of the leg? Nerve of the anterior compartment. Guess this. Which is the nerve of the anterior compartment? Any guesses? Yes, this yes, very good. You're very interactive. No, superficial peroneal nerve nahi hai. Ibiza. Superficial peroneal is a nerve of the lateral compartment of the leg. It's a nerve of lateral compartment, which is a nerve of the anterior compartment of the leg. Anterior. That's the deep peroneal nerve. Okay. Nerve of the anterior compartment of the leg is the deep peroneal nerve. And which is the artery of the anterior compartment? Any guesses? Artery of the anterior compartment of the leg is the anterior tibial artery. So the nerve is the deep peroneal nerve. The artery is anterior tibial artery. For the lateral compartment, which is the nerve in the lateral compartment? Lateral compartment में दो muscles है, peroneus longus, peroneus brevis. So which is the nerve of exams ना? Exams अभी तक चल रहा है बच्चों. Exams का talks are going on. The nerve of the lateral compartment of the leg is superficial peroneal, and the artery is peroneal artery. Lateral compartment superficial peroneal, artery is peroneal artery. ठीक है? And which is the nerve of the posterior compartment? Tibial nerve. The nerve of the posterior compartment is tibial nerve, and the artery of the posterior compartment is posterior tibial artery. So once again, to recapitulate, posterior compartment of the leg, the tibial nerve and the posterior tibial artery. Lateral compartment of the leg, the superficial nerve and superficial peroneal nerve and the peroneal artery. Anterior compartment is the deep peroneal nerve and the anterior tibial artery. I hope everything is clear to all of you, and thank you for a very interactive session. Very good, students. You should be interacting like this so that your concepts gets cleared, your doubt gets cleared. And if you make mistakes, you'll always remember this later when you're solving the MCQs. Okay, so do come back and I'll announce another lecture. It will be tomorrow or day after. I'll post that for you. Okay, thank you to all of you once again for the space.